On the human side, we use QD to signify once daily, and on the veterinary side, we see SID. But the problem with that is if somebody were to have SID written on a script, it looks very similar to the human QID, meaning 4 times daily. And so we wouldn't want our pets to accidentally get a medication 4 times daily that they were supposed to get once daily.
Pharmacokinetics is so different in our veterinary species compared to humans that the dosing and frequency of those medications are going to be severely different. And a good example is levothyroxine. That one in particular, I always love to harp on, especially for our pharmacists, because the frequency that we give is every 12 hours in dogs, and that's unheard of in humans, right?
Welcome to Medication Talk, an official podcast of TRC Healthcare, home of Pharmacist Letter, Prescriber Insights, and the most trusted clinical resources. Proud to be celebrating 40 years of unbiased evidence and recommendations. On this episode, our expert panel explores the clinical challenges of veterinary pharmacology, discussing medications, supplements, and inactive ingredients that can be dangerous to pets. You'll hear practical dispensing and safety guidance, along with evidence-based strategies to help pharmacists protect animal patients from accidental exposure to human medications. Our guests today are Dr. Alexandria Gochenauer, a board-certified veterinary pharmacist and an interim pharmacy manager at Walmart Pharmacy, and the president-elect of the American College of Veterinary Pharmacists. Dr. Erica Wassack, also a board-certified veterinary pharmacist and the associate pharmacy officer of Plumb's veterinary drugs at Instinct Science. And Dr. Tina Wismer, a veterinarian and senior director of poison control at the American Society for the Prevention of Cruelty to Animals, or ASPCA. This podcast is an excerpt from one of TRC's monthly Live CE webinars. Each month, experts and frontline providers discuss and debate challenges in practice, evidence-based practice recommendations, and other topics relevant to our subscribers.
And now, the CE information.
This podcast offers continuing education credit for pharmacists, pharmacy technicians, physicians, and nurses. Please log into your Pharmacist Letter, Pharmacy Technician's Letter, or Prescriber Insights account and look for the title of this podcast in the list of available CE courses. None of the speakers have anything to disclose. Now, let's join TRC editors, Drs. Stephen Small and Sarah Clockers, and start our discussion.
Let's first start off with some background on differences between animals and humans when it comes to meds. So, to start off with here, Erica, how do cats and dogs process medications differently from humans?
Yeah, so what I love to say is that animals are not tiny humans, and dogs and cats process medications very differently. And animal pharmacokinetics as a whole can be very different and confusing. But when we talk about different species, like dogs in particular, just some examples are they have a higher blood volume, which can result in lower plasma concentration when you're using human drugs. Their elimination half-life is a whole lot shorter because we have about 2.5 times a faster glomerular filtration rate compared to humans, and an even more acidic pH in the kidneys compared. Metabolism-wise, dogs can't acetylate drugs, which is very different. And then, of course, cats. Cats are our fun, deficient babies. They have all the problems when it comes to metabolism deficiency. They lack glucuronidation, they lack acetylation. They have about 2 to 4 times the amount of hemoglobin than humans, which can increase their risk for oxidative injury. So, there's so many differences when it comes to our pharmacokinetics.
And Alex, how are pet prescriptions different from human prescriptions? What are some maybe differences to highlight there for listeners?
Yeah, there's quite a few ways that they're alike, but there's also many ways that they differ. I think the most notable for some of our customers is that human prescriptions are often covered by health insurance, whereas our pet medications are usually paid out of pocket. Sometimes we do see pet insurance, but it's more of a reimbursement type setup. And then for our pharmacists, our veterinarians don't have NPI numbers, which are assigned to providers by the Center for Medicare and Medicaid Services. So it's technically fraud if they were to have these numbers. And so we see a little bit of issue with getting some of our veterinarians into our pharmacy systems. But luckily, we do have a license information, and if they prescribe controlled substances, we can utilize their DEA number. Some other things are that many drugs are prescribed to animals that are human medications and are being used off label. And then our abbreviations can differ in our prescriptions. So on the human side, we use QD to signify once daily. And on the veterinary side, we see SID. But the problem with that is if somebody were to have SID written on a script, it looks very similar to the human QID, meaning 4 times daily. And so we wouldn't want our pets to accidentally get a medication 4 times daily that they were supposed to get once daily. We also have some differing brand names for our veterinary medications, so that can cause a little bit of confusion with prescribing practices. And then our liquid concentrations, they're not only stated per mil, but we often see that the drug concentration is a combination of the two active components if there's more than one medication in there. So for Clavamox, on the package, it's listed as 62.5 milligrams, but it contains 50 milligrams of amoxicillin and then 12.5 milligrams of that clavulanic acid. And then I would say the last difference, as Erica kind of mentioned before, is that we do have the species specific dosing, which is very critical, which is quite different from humans, where we typically have our one approved dose for adults with a few variations depending on age and kidney function. And then we have one approved dose for children.
That's good to have that in perspective. And Alex, we're getting an audience question right now asking if pet meds are required to be sent electronically. We know that some states require prescriptions, even controlled substances, to be electronically sent to pharmacies if prescribers have the capability. But does that also apply to pet prescriptions here?
Yeah, so I actually was in Illinois before I moved to my current state in Indiana. And they made a little snippet on their requirement for electronic prescriptions that if the practice was so small that they couldn't afford electronic prescriptions or they just didn't have the capacity to do that, that they do get a pass. So I believe it would be pretty similar with other states where they do not require those electronic prescriptions for veterinary patients as long as they have everything filled out appropriately on the prescription.
Yeah, I will also say too, like, it's being worked on. Like, I think veterinarians realize the frustration not having electronic prescribing. So it is constantly something that veterinarians are looking into. And it's kind of exciting because it's kind of like the frontier in veterinary medicine, like electronic prescribing. But yeah, a lot of states do have exemptions in their law that say veterinarians are exempt from this.
Thank you for that. It's best to refer to your state laws and pharmacy policies since it can vary. And then, Tina, our question for you is: are human approved meds better than veterinary only versions?
So, if we only use veterinary approved versions in veterinary medicine, we would probably only have a double handful of drugs available to us. We actually mostly use off label human approved medications. We occasionally get a drug on the veterinary side before we get it on the human side, but most commonly it goes the other way.
And then, Erica, what are other legal considerations with pet meds? I'm sure it can be daunting for folks since it's a whole different species. Are there any differences to think about there or to highlight?
Yeah, so big ones is making sure you identify the species on the label of the prescription. Because a lot of our animals have human names like Felicia or, Dawn or something along those lines. And so making sure you can identify that particular species because that's really important. Also adding for veterinary use on your prescription labels just to help identify that's actually required by law to do that. You want to also avoid dispensing the prescriptions under the owner's name because, again, like Alex was talking about, like, that could be considered fraud. But you might have the patient name, but then you also might have the owner's name on that label, so it can get kinda confusing, so being sure you can separate those as well.
Now let's talk a bit more about using human medications in our furry friends. Alex, can you give us some examples of when we'd consider using human meds for pets?
Yeah. As Tina mentioned before, it's actually quite common in veterinary medicine, but it does still have to be done with caution and under the guidance of a licensed veterinarian. So we refer to this as extra label drug use, and there's actually a specific act that allows this to happen. So, some of the times when we would consider using human medications for pets can include when there is no approved veterinary equivalent, when a veterinary version is unavailable, back ordered, or discontinued. And unfortunately, we do see discontinuations a lot, I think just because there isn't quite the market as there is for human medications. And then often when a dose or formulation needs customization. So if the strength of the medication isn't appropriate, the dosage form. So think about getting that big pill into your tiny cat's mouth, and then improving palatability or ease of administration.
And now, what are some human meds or supplements that are dangerous for pets that we should avoid? I've been told to avoid acetaminophen and ibuprofen use in our dog. Tina, are there others?
So you mentioned acetaminophen, right? Tylenol. There is an accepted dose in dogs. It's quite small, right? 10 mgs per kilo. We start to see methemoglobinemia at about 100 mgs per kilo. There is not a safe dose in cats for acetaminophen. Even small amounts can cause death in cats. So please, no acetaminophen. And you're right about the NSAIDs, right? The over-the-counter ones tend to be cheaper than the veterinary version. So owners want to know, yeah, can I give ibuprofen or can I give naproxen? And unfortunately, animals are really sensitive to those and it causes stomach ulcers and kidney failure. And it has to do with kinetics. One dose of naproxen in dogs has a 74-hour half-life, right? So 3 days for half of this to leave the system. So it certainly can be dangerous if they're giving it on multiple days. And then pseudoephedrine, it's like giving them speed. It really causes agitation, tachycardia, high heart rates, potentially seizures. And a weird thing, I guess it's not so weird because they tell me it happens in children too. These medications like nefazoline and oxymetazoline and tetrahydrozoline that we find in eye drops, these are alpha 2s. And in dogs and cats, they work as sedatives. So we can see dogs collapse and have really low heart rates. So, not a class of drugs to use in these animals. We get a lot of questions about using antidiarrheals in dogs and cats. And some of our over the counter ones, things like loperamide, we do have to be careful in certain species of dogs and about 5% of cats because they have issues with the multi drug resistant protein that keeps these drugs out of the CNS at high doses. So we certainly need to ask our vet before we give those drugs.
Thanks, Tina. That's a great point. And I just wanted to briefly review this multi drug resistant protein. This gene produces P glycoprotein, which we have heard about in humans. It's a transporter protein that pumps drugs out of the cells and it keeps drugs from passing into the brain. And so there's an animal with a multi-drug resistant or MDR gene mutation. Those animals are more sensitive to those drugs and they can build up and lead to toxicity in the animal. So we must be careful with loperamide, and this also impacts some cancer drugs and sedatives that veterinarians may use as well. And then we also wanted to touch on any harmful herbs or supplements that you get questions about, Tina.
So we get a lot of questions about CBD in dogs. Do have to mention that. And there is a therapeutic dose in dogs, but most of these are treat formulations. So, if one is good, the dog's going to eat the entire bag, and we can actually see THC signs at higher doses. But essential oils are also something we get concerned about. There are products with essential oils that are labeled for use in pets and they're safe. The problems that we run into are when people take the 100% tea tree oil and put it like in a wound or in the ear. And that's almost like giving it IV, and it can cause both neurologic problems and liver. And pennyroyal, which is sometimes promoted for use in flea control, also can cause severe neurologic signs. So, not something to use around our pets.
But the big one we really do use is glucosamine and chondroitin. However, this is one of those where we don't want to use the human product for glucosamine chondroitin and stick to the veterinary only products. Usually because our human ones are too high of a dose and actually can contain ingredients or inactive ingredients that are unsuitable for dogs.
And then we alluded to earlier what inactive ingredients should be avoided. And so just wanted to touch on the pharmacist is reviewing ingredient labels. What are some ingredients that we should raise that red flag again and avoid for our furry friends?
I think the most well-known one is going to be xylitol. So that is going to be toxic to dogs even in small amounts. And it can cause hypoglycemia and acute liver failure. It's often found in different tablet formulations, some liquid formulations, and then other marketed human products like gum and peanut butter. The most well-known drug that this was found in that was causing problems with is Neurontin, which is a liquid gabapentin solution. And so when a prescription is received for gabapentin, we do just have to double check if that liquid product contains xylitol to make sure it's safe for dispensing for our pets. We also know that alcohol is dangerous for both dogs and cats, especially if it's in an oral or a transdermal formulation. And we can see the hypoglycemia occur. We can see changes in blood pressure and body temperature, and it can cause some central nervous system depression.
Since we're talking about alcohols, I think we should also mention benzyl alcohol. We don't want to mix that with cats. They can have some respiratory depression and those type of issues because the liver cannot metabolize it.
Yeah, I also add on like azo dyes too for cats. Like that one's also a big one that's a common and active ingredient in some medications.
Oh, yes, all of those over-the-counter treat your urinary tract infections. Yes.
Yep.
Oh my goodness, propylene glycol. We can go down like a whole list in the rabbit hole when it comes to inactive ingredients. Well, I do wanna harp on what Alex said, though, like, with the liquid gabapentin. I think it's really important to, like, highlight that because there's only one brand of liquid gabapentin that does not contain xylitol. The issue with it is it's also a flavor combo that, like, cats hate your guts. It's a strawberry peppermint flavor, and cats are already hard to medicate, but man, if you give them that one, they hate you even more.
The good news is cats are not sensitive to xylitol, but definitely keep that away from dogs. But, oh, I cannot imagine trying to give my cat that liquid.
That strawberry peppermint, isn't it wonderful?
I got to do it last week. It was not a good time. My cat was not a fan. I do think there's one inactive ingredient that we commonly forget about, especially in general veterinary practice and maybe even just like retail pharmacy. But that polysorbate 80 that is in a lot of IV medications and injectables, it can cause anaphylactic reactions in cats. And if we're not practicing at that higher level of urgent and emergent care, we may not recognize it as often or as quickly as we need to.
Yeah, that's a good one. I also think, like, when we Alex was talking about all the medications that we use, like human medications and animals, I think the biggest things to, like, reiterate is that, pharmacokinetics is so different in our veterinary species compared to humans that the dosing and frequency of those medications are gonna be severely different. And a good example is levothyroxine. That one in particular, I always love to harp on, especially for our pharmacists, because, like, the frequency that we give is every 12 hours in dogs, and that's, like, unheard of in humans, right? And then, like, the dose is so low in humans, but, like, the bioavailability is so low in dogs that we need a higher dose just to get the concentration that we need. So, like, it does kinda shock a lot of pharmacists when they see levothyroxine for our small dogs and see such a high dose and twice a day. So that's one, like, I always wanna reiterate that we do use it, but be careful of it.
Yeah, your little tiny Shih Tzus and Poodles take more than people do. Yeah, it is something that I have written a prescription and gotten a call. "Are you sure?" "Yes. Yes, I am."
And just for anybody who isn't familiar with this at home, humans are dosed in micrograms, and oftentimes we see milligram dosing for animals. So, like 75 micrograms for a human, but like 800 micrograms to a milligram for animals.
Oh, yeah, that's a good one.
And then, Erica, are there recommended dosing references and resources that pharmacists should use or avoid in pets?
Plumb's Veterinary Drugs has everything there for veterinarians, for pharmacists. It gives you side effects, client resources, and counseling resources there, more than just dosing. It goes in the order of like the most common, so like dogs, cats first, horses, and they get into food animal, cattle. And then they do have exotics listed there if it's indicated for a particular drug. So it goes in order of like small ruminant. So you can have some camelids in there, sheep, goats, and then it goes into birds, ferrets, rabbits, and they can even get even more detailed with even more species.
And it's usually based on research studies that have been completed. So as soon as those research studies come out, when that drug comes up for updating, which I believe is about annually, they will go through all of the new published research and make sure that everything is appropriate and up to date.
Merck Manual was also a great one. That one's just if you wanna get, like, a great synopsis of that disease state and kind of like a small recommendation, and then the biggest one I love to talk about too is the Animal Poison Control Center because that has been a lifesaver for a lot of our pets. I know they charge a consultation fee, but it's so worth that money just to know that our patients are safe.
I have to say Plum has doses for all different species, and it's got, like, what happens in an overdose and those type of things, so it's a really good resource. I do have to put in a plug. If you're in an area where you have exotic animal veterinarians that are seeing a lot of pocket pets and things like that, Carpenter's Exotic Animal Formula also is a nice resource.
Yeah, that's a great one.
And I think if we're getting into like the weeds, the FDA's Green Book has the list of FDA approved animal drugs and then shows you those approved species indication as well as withdrawal times for food animals. That can be extremely helpful. And I believe this may only be for veterinarians and people associated with the veterinary field, but Veterinary Information Network has really great articles and clinical information as well.
Well, you mentioned food animals, Alex. I think another great resource is FARAD. It's the Food Animal Residue Avoidance Database, and so that's something that also have, like, off-label uses of withdrawal times and things like that, so that can also be very helpful.
And some folks may be less familiar with the Green Book and may want to know how that compares to FDA's Orange Book, which we commonly use for looking at therapeutic equivalents for human meds. How is the Green Book different here?
Yeah, it's similar. So we're looking at A/B approvals on the Orange Book. So what can be switched out via branded generic. The Green Book, also created by the FDA, but it is going to only have those FDA approved indications. So anything that's being used extra label will not be in that book, but it could be very beneficial for somebody who wants to do some type of research study or needs information about what is actually FDA approved versus what's being used off label.
Yeah, and I also wanna add on to that, Alex did a great job, is also in veterinary for the Green Book, it includes both prescription and over the counter because all veterinary drugs that are over the counter are FDA approved.
Excellent. Great caveats there. And let's not forget that local veterinarians can also be a helpful resource. For example, consider keeping a list of after hours phone numbers for emergency veterinary clinics in your area. This can be helpful for you in terms of pet med questions, but it can also be important for managing possible pet poisonings. And with that in mind, how can we protect pets from ingesting their owner's meds at home by accident?
I think the biggest thing is just like we counsel with humans, storing their medications appropriately in an area that's not high traffic. I also encourage to keep their human and pet medications separate. But I can actually, like, on a personal experience, talk about this because my cat's a wonderful example. Like, he got into so many cabinets. He was like Houdini getting into things. And so, making sure it's in a height enough where your dogs and cats can't jump into an area because you see this cat wonderfully like to get into a cabinet. That was mine. You can lock it. So try to, just like we don't want our kids to get into medications, like we don't want our animals to get into medications. So we just want to keep it in an area, again, dry area like we do in humans, but definitely put it high enough where our furry friends can't reach.
Yeah. And baby locks. Baby locks, baby gates, these are your best friend, depending upon your dog or cat.
Yes, I literally had baby locks before I even had my, like, human children probably because of this.
And is it worth mentioning at all about childproof containers? Are those even enough for some pets? Will they just chew through packaging that we need to think about?
Oh, no, like, you wanna make sure it's hard to get to. I don't know, I just had a fun story where, some owners like to store their medications under the bed or anything like that. Man, some of our veterinary friends can definitely get into hard spaces, so, like, you wanna make sure that it's securely locked, securely away from where they can get into things.
Yes, and especially if we're dealing with chewable formulations of medications. We've had a huge thing in vet med recently. We've had oclacitinib. It's used for allergies in dogs, and it's been out, gosh, I don't know, 7 years, 10 years, and it hasn't been a problem until October of 2023 when they released the chewable formulation. And now we have animals eating entire bottles and dying from kidney failure. So it's definitely something that we need to tell owners about when we're sending home a prescription. Keep this away from your pets.
Dogs are opportunistic gorgers. They'll do like, if there's an opportunity, they'll go for it. So we just gotta be cautious.
I mean, and pills rattling around in a bottle is a great toy for them, right? So they chew into it, as you said. Baby baby locks? No. Or childproof caps? No. Right? They just chew right through the plastic. So yeah.
And are there any recommendations if maybe a liquid medication is spilled or if maybe pills are dropped on the floor if you have one stray pill? Is that a common mode of intoxication, Tina? Have you seen that a lot in your practice where maybe they didn't clean up a spill sufficiently and just licking it a little bit can cause a major issue?
Yeah, depending on the drug, it can. Or, an owner drops their medication and the dog's right there and eats it. So we do recommend, especially for, older people or people who may not have really good dexterity in their hands, to actually take their pills over the sink. So if they do drop it, it lands in the sink. Because especially some of these cardiac medications can be severely dangerous to animals.
I really like that point. Take pills over the sink. Since I agree, it can be really hard to locate a dropped tablet or capsule on the ground, and pets are likely to find and eat them. This is also a good moment to highlight safety around fentanyl patch disposal. Pets have died from accessing used patches thrown in the trash because then they'll potentially eat or chew on them. And the FDA recommends avoiding putting used fentanyl patches in the trash because of this. Instead, they recommend patients should fold the sticky sides together and then flush that down the toilet to totally eliminate that risk. Similarly, topical medications can pose a risk. For example, humans using topical hormone products such as testosterone can actually transfer the medication to their pet when holding or petting them. There are case reports of exposed pets having sexual or developmental side effects after exposure because of this. And similar reports have even been seen in kids and partners who may have had skin contact with testosterone patients. And that's why many topical testosterone products have box warnings about this. So it's best to counsel owners taking topical hormones to wash their hands after every use, cover administration sites with clothing, and wash any application sites before holding or handling pets if there might be contact there. That is a great segue into our next question for you, Tina. What should owners do if their pet accidentally ingests a med? Should pet owners keep anything in the home just in case as an antidote or things like that?
So the first thing is don't panic, right? And then we want to give your veterinarian a call, right? And they should be able to determine from the weight and the milligram and the number of pills ingested whether or not this is going to be a problem. If they don't know, they can talk to one of the poison control centers. And we sometimes induce vomiting at home in dogs. We actually use 3% hydrogen peroxide, the stuff in the brown bottle that you put on your cuts and scrapes, but you need to get an appropriate dose per weight for your animal. There's nothing safe to do that at home in cats. So it's all about determining, is it a problem and do you need to see the veterinarian?
And let's say if we get one of these phone calls in the pharmacy, Alex, is it best to then refer the pet owner to maybe the nearest veterinarian or whatever phone number they have on hand? Or is it better to have them contact Tina at ASPCA? What is the best approach there?
Yeah, so they can do either or. I would say whatever is going to be the quickest. A lot of times we will have people call the pet poison helpline on their way to the veterinarian because they do charge that consultation fee. So the owner has to call in and at least get the pet established with the pet poison helpline. As Tina mentioned, we never want to tell them to do anything to induce vomiting at home unless they're instructed by veterinarian or poison control because with our dogs especially, we can see that they ingest caustic or corrosive medications, and bringing that back up actually causes further damage and secondary complications.
And a good acronym to help clients know when to call a veterinarian in these cases is BESTIE, since veterinarians are your best friend in these circumstances. Watch for behavior changes, eating less, skin redness, scabs or seizures, tremors or tarry stools, nausea or vomiting, and inappropriate urination, which can be more or less frequent.
We hope you enjoyed and gained practical insights from listening to this discussion. Now that you've listened, pharmacists, pharmacy technicians, physicians, and nurses can receive CE credit. Just log into your pharmacist letter, pharmacy technician's letter, or prescriber insights account and look for the title of this podcast in the list of available CE courses. On those websites, you'll also be able to access and print out additional materials on this topic, like charts and other quick reference tools. If you're not yet a pharmacist letter, pharmacy technician's letter, or prescriber insights subscriber, now's the time. Sign up today to stay ahead with trusted, unbiased insights and continuing education. And as a listener, you can save 10% on a new subscription with code MT1025 at checkout. Be sure to follow or subscribe, rate, and review this show in your favorite podcast app. Or find the show on YouTube by searching for TRC Healthcare or clicking the link in the show notes. You can also reach out to provide feedback or make suggestions by emailing us at contactus@trchealthcare.com. Thanks for listening to Medication Talk.